Well, it's only fitting that we would play I'm a Man, Yes I Am, But I Can't Help But Love You So to introduce Lyn Rowe. Why didn't you guys play Woman, Hear Me Roar?
Next time.
Lyn Rowe, certified financial planner. You brought up something last segment that tweaked my interest. You said something like this: long-term care benefits may reduce end-of-life medical costs. Now, as you know, I have been in the retirement planning business, retired now,
Yes.
for many, many, many years.
Yes.
And the one thing that we always freaked out about were the end-of-life benefits that you couldn't really forecast. You had to just put a pile of money away
Medical costs.
somewhere. Sure.
Yeah.
So what you're saying is if you have handled it with long-term care insurance, all the other medical costs go away? Explain, it doesn't make sense.
Well, this is actually from the American Association of Long-Term Care Insurance, and the studies indicate, and here's some statistics. You love statistics?
I do, I love them.
Okay. Claimants using long-term care benefits experience significantly lower health care costs at the end of life, including 14% lower medical costs, total medical costs.
Really?
Yeah. Lower pharmacy costs, 35% lower inpatient admission costs, and 16% lower outpatient visit costs. Why would you think that that would happen?
Well, that's what I asked you, and you said something about the care was better. Is that a fact?
That is a fact.
And why would the care be better?
Because you have professionals who are bonded, vetted, licensed people giving that care, doing what they do.
You're throwing around some numbers here that could be pretty significant. If $200,000 is what it costs,
it's actually $224 according to Fidelity,
okay,
but that's okay.
But if it's a couple $100,000 and there's, I don't know, somewhere between 10 and 30% savings.
35%
We're talking some
inpatient
pretty serious money here.
Very serious money.
Maybe enough to cover the actual cost for 20 years of long-term care insurance policies.
Bingo. Thank you very much. That is exactly
well,
right.
you owe me now. So
I owe you all the way.
of course. Those are stunning statistics. I
Yes.
made you copy them for me because I didn't believe them, but now I have them in front of me,
Yeah.
and it is absolutely spot on.
Yep.
This is coming from the source book.
Yes.
Key findings from recent studies. The following are interesting conclusions and facts from studies and reports published recently. Wow.
Yes. So having that professional providing the care on a regular basis at home, and 70% of the claims, we know that 70% of those claims going into the insurance companies right now for long-term care are at home. People are in their own environment, they're with their family, and that's, you can't quantify that. That is an immeasurable plus. They're with their friends, they're with their pets, another immeasurable cost, and they're in their own environment. People feel better at home. They tend to heal quicker at home. But having that professional as opposed to a worn out family member is a big deal. It's a huge deal.
All right, so I get emails from time to time
Yes.
from our fantastic viewers and listeners. And some of them just say, you know what, it's too much. You guys are just scaring the heck out of me, and I don't really want to hear it. There's a sense of denial.
We've talked
out
about that
there.
river, yes.
So why don't you look into the camera and talk to these folks about why they need to act?
Well, first of all, you're doing yourself a favor because you are ensuring that you are going to get better care, because a worn out family member can only do so much. You are ensuring that your family is going to be in better health because they are not working themselves to death giving you care. And number three, you are also giving yourself a much better shot at protecting those assets. Not just, and many people say, well, I don't care after I'm gone for the kids, we're not worried about that. I'm more concerned about you and your spouse. Will those assets last the rest of your life? Now, 70% of the people in skilled nursing today are on public assistance. These people were not flakes, they were not crooks. They were people who worked hard all their lives and thought they had that covered. But you know what? We're going to talk about this next time. The cost to this country is enormous. And if we want to step up to the plate, we're in an election season. We're all talking about elections and what we can do to take care of our country's finances. Well, here's one of the things we can each do to take care of our country's finances.
Now, I've heard you recently talk about long-term care financial planning.
Yes.
I think most of us understand what real financial planning is, although 56% of us don't do it. But what is long-term care financial planning?
Well, let me say that it too is real financial planning, because we've already said that that's a huge part of your budget. Having that medical side covered is a huge part of your budget in retirement. We figure $225,000 or so, according to the Fidelity study, is simply medical costs. And if those medical costs are reduced dramatically, and we saw in some cases 35%, can be affected by having quality long-term care coverage that takes care of you at home, then you are taking care of your retirement planning as well as the long-term care planning. You're meeting those together. Now, here's another thing. Is it affordable? Yes. We can make it affordable. Some is better than none. Some is better than none. Some is better than none.
IWantMyLTC.net is Lyn's website. Check her out online. She is the world's expert on this stuff, no doubt. 877-270-3127. I'm going to do this one slow for you so you can write it on your hand. 877-270-3127. If you're driving, just sing this IWantMyLTC.net song in your head. And that way, when you get to wherever you're going, you can shoot Lyn an email and see how affordable it can be. You brought up something today that I hadn't thought about before, and you know me, I've thought about almost everything. But today, you gave me a way to pay for it. Because if, in fact, I can reduce the future cost of end-of-life medical costs,
yes,
by 20 to 30%.
Yes.
That's $50,000 or $60,000.
Thank you.
Presumably lying out there that I can spend on providing for because we haven't talked about the long-term care costs. That's just end-of-life other medical costs. Long-term care is on top of that. So you're really looking at $400,000 or $500,000
today's dollars
in expenses.
Yes.
So and this is why, by the way, and I quote from some study almost on a daily basis, Lyn. And every single one of the finance professors that are out there, Michael Fink, Wade Pfau, Michael Kitces, David Blanchett, Moshe Malevsky, I can go on and on. Virtually every single one of them puts healthcare at the top of the retirement list, but unfortunately, most of the consuming public shunts it down to the bottom.
Right. Well, we all are kind of in the back of our mind thinking somebody's going to take care of it. The government's going to take care of it. The government can only do, we are the government. And we're already concerned about the finances and the unfunded liabilities. And the unfunded liabilities include Medicare, but Medicaid is the #1 provider right now of that coverage. And we can't do that any longer.
I have 2 letters to describe what you just said.
Yes.
VA.
Yeah.
The Veterans Administration.
Perfect example.
The government's been taking really good care of the veterans from a healthcare standpoint, right?
Yeah.
So it really is time for us to step up to the plate and take care of ourselves. Now, I'm very interested, we only have a minute left, but I'm very interested in baby boomers taking care of their parents. I'm also interested in Generation Xers taking care of the baby boomer parents who are on the precipice of retirement. How does that work in 30 seconds or less?
You need to have a conversation and find out what they've got in place somehow. I will facilitate those conversations, and I've done that many times with a conference call. We can get everybody on the phone and talk about it.
And you don't charge for that?
No.
It's amazing. Listen, folks, this is something that may be one of the most important phone calls you'll ever make. So do this. Do it for me. Do it for you. Do it for your mom and dad. Do it for your kids. 877-270-3127. 877-270-3127. IWantMyLTC.net. Thank you, Lyn. That was awesome.
Thank you.
Nice work. We'll talk again next week when you co-host once again with me. I appreciate you and all that retirement advice, too.
My pleasure.
It's good stuff. All right, I'm going to keep these, and you might find these stats in a blog that I write about long-term care, just for you. This is phenomenal stuff. If you want the stats, by the way, just go to Lyn's website. She'll shoot you a copy of this. I want my LTC.net. When we come back, Bobby Wooldridge and me will be tackling your money questions right here, right now. Bobby, can you handle that? Oh, he says yes. And right on the Ray Lucia Show. Stick around.